Hello everyone, I'm Dr. Farhan Tahir, rheumatologist and pain management physician. I see many patients every day who take anti-inflammatory medicines for joint pains, for back pains or headaches. Anti-inflammatory medicines reduce pain and inflammation. They are available over the counter by the names of Advil, Aleve, Motrin, and most of the time patients are confused if they have any side effects or is there any need for being careful about how many of those medicines can be taken in a 24-hour period. A study published recently found out that about 15% of patients, adults who have pain and use anti-inflammatory medicines, they tend to overexceed the use of these medicines and cross the safety limit. This can cause many problems. The study looked at patients who were given an online questionnaire about their use of anti-inflammatory medicines, and about 11% of those patients who were using ibuprofen did not know what the safe dose of this drug is. Although this drug has been available over the counter, it does not mean that you can take as much as you want, but on the contrary, you have to be still careful about its use because it can cause three major problems. It can cause acute kidney injury or acute kidney failure. It can also cause high risk of gastrointestinal bleeding, and it is also associated with risk of heart diseases or acute heart attack. Now, how would a pain medicine cause all of these problems? Well, you have to look at the mechanism of action of these medicines. Anti-inflammatory medicines reduce pain and swelling and inflammation by reducing the production of a chemical in our blood called prostaglandin. When you are reducing prostaglandin production in the joints, they reduce pain and swelling. But remember, the prostaglandins are also produced in kidneys to keep kidney function in order. If you reduce prostaglandin too much, you affect the kidney's ability to balance your electrolytes, water, and also their ability to get rid of toxic material. So when you're reducing pain and inflammation, you might be affecting your kidneys without knowing about it. Marathon runners, high endurance training exercise athletes, they tend to be overheated and dehydrated when they're performing these activities. They have to be super careful about use of anti-inflammatory medicines in those situations. And it has been found out that there's a certain group of patients who are actually at a higher risk of overdosing themselves with anti-inflammatory medicines. They tend to be male who have ongoing pain issues, they have poor physical function, and they are smokers on daily basis, and they have an attitude of choosing my own dose of medicine. They're not starting usually at the lowest dose possible, which is usually 200 milligrams. They would start it as a 400 or a 600 milligram on any given time. So a poor knowledge about medicine can cause a bigger major health issue. So also remember that you should talk to your physicians about what is the safe drug for you to take when you have pain, making sure that you are hydrated, well rested when you're taking anti-inflammatory medicines, and avoid extreme conditions of overheat and exhaustion when you have actually taken NSAIDs. There's been studies published that have found out that athletic trainers and marathon runners had higher risk of developing kidney injury and muscle damage when they had taken excessive use of anti-inflammatory medicines before and after marathon. I hope you will find this useful. I wish you best of luck for your health and wellness.